and welcome to our conversation tonight, Say Her Name, Racial Profiling of Black Women During the Pandemic. My name is Dr. Wisdom Powell, and it is my pleasure and privilege to invite you to tonight's virtual gathering of leaders and call to action. Before we get started, I'd like to do a brief introduction of our panelists, but I want to first lift up the names of Black women who have been the victims of police-related violence and racial profiling. We say their names tonight knowing that these are not the only Black women who have suffered at the hands of this kind of racial injustice. So we lift them up to remind us all that it is important that we center the experiences also of Black women as we are moving towards an agenda for more racial justice. So we say the names of Pamela Turner, of Sandra Bland, of Corrine Gaines, of Tatiana Jefferson, of Chantel Davis, of Sandy Bland, and of course, of Breonna Taylor. With those names in our ears and their stories in our hearts, I'd like to introduce our guest panelists. I am Wisdom Powell. I'm the director of the Health Disparities Institute and associate professor of psychiatry at UConn Health. I also serve as president of the American Psychological Association's Division 51 for Men and Masculinities. I'd like to now introduce our illustrious panel. First, Dr. Amani Allen, who is an executive associate dean and associate professor of community health sciences and epidemiology at the University of California, Berkeley School of Public Health. She will tell you a little bit more about her research, but it focused generally on race and socioeconomic health disparities and the measurement and study of racism as a social determinant of health. Welcome, Dr. Allen. Next, I'd like to introduce Dr. Chandra Ford. Dr. Ford is Associate Professor of Community Health Sciences and founding director of the Center for the Study of Racism, Social Justice, and Health at the Fielding School of Public Health at the University of California at Los Angeles. Most of her research falls into two broad areas: empirical research examining the relationship between specific forms of racism and disparities in HIV testing and care, and laying a conceptual and methodological foundation for the work to improve the tools available for studying racism as a public health issue. Welcome, Dr. Ford. Next, it is my privilege to introduce Dr. Whitney Laster Pirtle, who is now currently a professor at the University of California, Merced. And she's currently also an assistant professor of sociology there with affiliations in public health and critical race and ethnic studies. She directs the Sociology of Health and Equity, or SHE Lab, and her work explores issues related to race, identity, inequality, and health. Welcome, Dr. Pirtle. Next, I'd like to introduce Paige Fernandez, who is the Policing Policy Advisor in the ACLU's National Political Advocacy Department, where she develops and implements comprehensive strategies that achieve a clear vision of effective, democratic, and constitutional policing to establish and reinforce community trust in our peacekeepers. Welcome, Ms. Fernandez. And last, and certainly not least, Dr. Ndidiamaka Amutah-Onukagha, I hope I got that right, who is currently on faculty at Tufts University. She is a professor in the Department of Public Health, if I'm reading this right, sorry about that, and is the former president of the Society of the African American Public Health Issues Association, and currently serves on the board of directors for the National Women's Health Network. Additionally, she also serves in the Department of Public Health and Community Medicine at Tufts University School of Medicine. So welcome to all of our panelists, and thank you to our audience for joining us tonight and listening to the biographies of these amazing sister scholars who are going to walk us through a conversation and a call to action. I would like to sort of set up our discussion roadmap so that folks will understand the arc of our conversation. Our goal here tonight is to move from describing the facts and the evidence towards community action and policy solutions in the interest of creating systems change. So we're going to start tonight's conversation off by recognizing that the racial disparities in COVID-19 in our country are also still operating alongside the issues around racial profiling and racial justice. We want to drive home the fact that it is important that in this conversation that we're having nationally, that we center the experiences of Black women and girls and that we hold space for them. So we're going to start this conversation out by asking each of the panelists to talk a little bit about their current work or initiatives that connect directly either to the issues around racial profiling and racial justice for Black women or their health disparities writ large. And I'm going to start that conversation with Dr. Pirtle.
Thank you for that introduction and for bringing us together on this webinar, for allowing us to center Black women and to say her name. So I describe myself as a Black feminist sociologist. I wear a lot of different hats in the work that I do, including editing a book, co-editing with Zakiya Luna, a book on Black feminist sociology, and also writing about anti-Blackness on college campuses. But most relevant to this conversation, I'm a Black feminist sociologist who studies race and health equity. So my attention has shifted towards some of the immediate pressing problems that you've already identified in this introduction. So we're confronted with a viral pandemic that's restricting airways of Black Americans at a disproportionate rate. And as state-sanctioned actors through the police are also stealing breath of Black Americans, to quote yesterday's heavy-hitting piece in the New England Journal of Medicine. These are called parallel plagues rooted in oppression. I recently wrote about some of those roots, most specifically about the mutually constituted system of racial capitalism as a fundamental cause of disease inequities that shapes the loss of Black life in the face of COVID-19. But I agree with you that it's important that women don't get lost within this conversation. So now I'm thinking about how racism, capitalism, and sexism act as intersecting axes of oppression that contribute to death gaps. So I believe that honoring all Black women, including cisgender, trans, non-binary femmes, must be a central part of the conversation right now. And this is because Black feminists, as Black feminists told us in the Combahee River Collective long ago, that if Black women were free, it would mean that everyone else would have to be free, since our freedom would necessitate the destruction of all systems of oppression. So I'm just happy to be here, a part of this conversation, working with you all, thinking about how we can all get free.
Thank you so much, Dr. Pirtle. Now we're going to invite Dr. Amani Allen to tell us a little bit about her work in this space.
Well, hello, everyone. Good afternoon. I'm on the West Coast, so it's afternoon here, but good evening to everyone who's not on the West Coast. And thank you, Dr. Powell, for inviting me to participate in this very important discussion, again, centering Black women's voices and also Black women's experiences. I just want to kind of take my hat off and give honor to all the other incredible women that are on this call right now. So in general, my work it has centered for a long time on one central question, and that is, why do Blacks live sicker and die sooner than others? But as I started to dig into the data myself, that question morphed into, why do Black women live sicker and die sooner than others? And this is not to pit Black men against Black women, but it is to recognize the unique positionality of Black women when it comes to health inequities. Across a number of health outcomes, Black women do tend to live sicker and die sooner than others, and in particular, compared to their white women counterparts, but also compared to men of other racial and ethnic groups. And I think for a long time, when we just think about gender and health in general, we have often focused on women in relation to their reproduction or to their role as mothers. And we've also thought a lot about mental health. And as a result of that, I have come to really see Black women as kind of a hidden vulnerable group, because when it comes to their overall health and well-being, I think that there has not been enough attention paid to them compared to other race, gender groups. In particular, one of the stark statistics that we see is that Black women tend to have or experience a higher rate of physiologic aging or biological aging. And in general, Blacks tend to experience a higher rate of biological aging compared to whites. But even just among Blacks, Black women are experiencing a faster rate of biological aging, even compared to Black men. And so we know that these disparities exist, but then the question becomes why, right? And one of the important aspects of biological aging is that we're talking about multi-system physiologic dysregulation that leaves Black women more susceptible to a variety of poor health outcomes later on. And so, you know, all kinds of chronic diseases, poor birth outcomes, maternal mortality, and premature mortality more broadly. And so I'm entering this conversation from the perspective of not do disparities exist, because we know that not only disparities exist, but inequities exist. And I want to move us from talking about just disparities, because that just means difference, and really framing this around inequities, because that brings in a lens and a framing around unjust, unfair differences, right? These are not just differences that are randomly distributed throughout the population. There is a systematic lessening of the health and well-being of Black women. And so I'm entering this conversation not from the perspective of what, but from the perspective of how and why, and really trying to better understand what factors are accounting for the disproportionately poor health outcomes that we see among Black women.
I really appreciate that thorough background, and you've also given us a lot of material with which we can enter this conversation. So I'm going to move us to Dr. Amutah-Onukagha to introduce herself and to tell us about the wonderful work she's doing at Tufts University.
Thank you so much. Good evening, everyone. Thank you so much to Dr. Wisdom for inviting us and convening this group of wonderful women. I'm so honored to be amongst you all. My work really centers on addressing the inequities around maternal mortality and morbidity. I'm really, really concerned at the statistic that I'm seeing. I'm disparaged, I'm discouraged by the rates that we're seeing around Black women, and I'm also encouraged by some of the opportunities there are to address these things. We know that systemic racism really plays a role in the exacerbation of disparities and increases to, like Dr. Allen said, premature death, maternal mortality. We saw this potentially could have played out with Serena Williams and Beyonce. We know that there's so many women fall through the cracks because of the dismissiveness, the disrespectfulness when they encounter clinical care. So my work here really centers the voices of Black women. And I also am aiming to uplift the role of doulas, midwives, community health workers as ways to mitigate the inequities that we see in the clinical care system. So thank you all so much.
Wonderful and beautiful and important work. Dr. Ford, welcome to the panel.
Good evening, and thank you for having me. It's such a privilege to be here. Thank you, Dr. Powell, for organizing this. My notes for this refer to this panel as the Boss Bomb panel, so thank you. In terms of my work right now, I'm thinking about, in particular with tonight's panel, 2 recently published essays that one focused on the role of policing and racism for the Black community. And the Black community's experience with carceral violence is much more extensive than what we typically think of. And so how can we begin to incorporate not only anti-racist analyses, but also analyses that recognize the ways in which policing is simultaneously gendered and sexualized? For me, I'm interested in placing these 2 essays in conversation with one another and with you all tonight here to think about the implications for women who live, love, and labor in the deepest margins of our society. And so for one, I think about how thinking intersectionally about populations, as we do in public health, might help us to think about as one example for me, the serial murders of Black women in Los Angeles. And I'm also interested in the ways in which policing has rendered them invisible. But as we'll talk about a little bit later, I'm also interested in the implications for thinking about what's happening with transgender women of color, who are also marginalized during these combined pandemics by many of the conversations we have that overlook their needs. So thank you for having me, and I look forward to it.
Thank you so much, Dr. Ford. We're privileged to have you in the space. And, you know, we're being real formal now because we want you to get the backdrop, but we're going to break this down in just a second, and folks are going to lean back in their seats a little bit more. But before we do that, it is my esteemed pleasure to welcome Ms. Paige Fernandez to our panel. Paige.
Hi, everyone. It is such an honor to be on this panel with all of these wonderful women. Thank you for allowing me to be on this panel with you all. In my position at the ACLU, I kind of oversee and coordinate all of our policing, advocacy, and policy work on the state and local levels. And what I'm really trying to push in the ACLU and at large is broadening our understanding of policing and really coming to grapple with what public safety actually means and really interrogating what public safety means, especially for Black communities, right? Because police don't actually provide public safety for many people in the Black community. And I'm really trying to, you know, in concert with so many amazing Black-led organizations and activists, get to the core of the problem of policing. The underlying problem is not a lack of training or good procedures. It's the broadening of their scope and responsibilities, and quite frankly, the fact that since their policing's inception as a police force in Charleston, South Carolina, their sole task has been to oppress and inflict violence upon Black people in this country. And we absolutely must reckon with that in order to truly move forward and create systemic change in policing. And I'm honored to be here to discuss this today.
And I am so happy to have you, because I think what we really need is sort of unpacking of what we mean when we talk about racial profiling and police killings from a legal point of view. And, you know, a significant motivation, as you know, as we've discussed in our prep call for this conversation, was the murder of Breonna Taylor, who would have celebrated, had she lived, her 27th birthday last week on June 5th. So can you briefly walk us through, just for the sake of level setting tonight, so that we are truly saying her name, the facts of the Breonna Taylor case? What happened? Where does the case stand now? And why have convictions been so uneven and more difficult to obtain in her case?
Absolutely. I first just want to start with talking about Breonna Taylor, right? So Breonna Taylor was born in Grand Rapids on June 5th, 1993. And she was an accomplished frontline healthcare worker in Louisville, Kentucky, where she went to the State's University and lived with her boyfriend, Kenneth Walker. And, you know, her mother, Tamika Palmer, said the other day that Breonna had big dreams of becoming a nurse and serving a lifelong career in healthcare. And I feel like it's really just important to center that here. And she was playing such a vital role in the midst of this pandemic, which makes, you know, her death all the more tragic. Her murder, I should say, all the more tragic. So on March 13th, Breonna and her boyfriend, Kenneth, were asleep when their apartment was raided by three plainclothed officers, so wearing nothing that would indicate that they are actual law enforcement, who were executing a no-knock warrant. And these warrants are incredibly problematic, right? Because it allows police to enter into your home without any warning and without identifying themselves. So it's just somebody barging into your home without any type of warning. And this no-knock warrant was executed because they were in search of people who they believed to be involved in some type of drug activity. And I really want that to sink in, right? Like, it was the war on drugs that resulted in the murder of Breonna Taylor, the failed war on drugs. Mr. Walker ended up calling 911 to report a break-in, literally as the cops were firing shots into his house. He did not know this was law enforcement. Breonna Taylor was shot at least 8 times. And, you know, when asked why they were at Breonna Taylor's house, they said that they thought there was some involvement in this drug case when they had already located the person that actually was the suspect in this case. That person was already in Louisville Police Department custody when they murdered Breonna Taylor. Where the case stands now, immediately after her murder, Mr. Walker was arrested by the police. The county attorney thankfully dismissed his all the charges against him, but that was after people had to get out in the streets and beg for all those charges to be dismissed. The 3 officers who were involved in the no-knock warrant and in Breonna Taylor's death have been placed on administrative reassignment pending an investigation, which I want to highlight is incredibly problematic because that means they are still getting paid after they murdered someone, and they are getting paid with taxpayers' dollars. The exact community that they harmed and inflicted so much pain and trauma on are paying them. The police chief in Louisville, Kentucky has resigned. I'm glad that he resigned, but it is not something worthy of celebration. He should have resigned. That is the bare minimum that should have happened. There is now an investigation being conducted by Louisville Metro's Police Department's Public Integrity Unit, and the FBI is investigating this. They have not made any public comments. As I say, it's an ongoing investigation. There's also some movement in Louisville because of all the public pressure on the mayor and on the city council that they've taken a few minor steps and made some policy changes. Last week, their mayor temporarily suspended all no-knock warrants. He named a new police chief. They have some new body camera policies in place, but definitely nothing implemented enough for true justice and accountability here.
I mean, just listening to those facts of the case, I mean, I've read them and many of us have read them, but hearing it laid out here in the way that you did makes the structural violence against Black women in this case more, evident. And I want to invite, here, Whitney, Dr. Pirtle, to talk a little bit about, structural violence and putting this in context, like structural violence against Black women, because we've had a lot of these kinds of incidents happen to Black women in the past and contemporarily, and yet we haven't really contextualized what that violence is about, how we are to understand it, why we should be concerned. Can you walk us through that?
Yeah, sure. And I agree. Thank you, Paige, for laying out the details of the case. I think anyone who has paid attention knows that there's something going on that's not okay. And that's why we need to lift up her name as we're memorializing people, that she was on the front lines to serve health, taking care of people during the pandemic, and our systems have failed us. It was a structurally violent system, right? So there were policies in place via legislation, via state-sanctioned organizations that allowed these things to occur. So I want the individuals who murdered her to be put to justice, but that's not enough, right? Because it's not just them as lone actors, it's the system that had allowed them to do that. And so I think when we're talking about structural violence, we have to implicate the system as much as anybody else. And so that's why people are on the streets to memorialize Breonna Taylor, Tony McDade, George Floyd, Sandra Bland, all of these people, but it's to say, okay, enough of us dying, enough of this violence, this violent murder. We need systemic policy change. We need defunding of the police, divestment into community groups. I'm thinking also about the book, The Death Gap, written by David Ansel, who was caring for patients in Chicago. And they said, as doctors, they're trained to treat bullet wounds, to treat people who are harmed, but that that puts a Band-Aid on the larger problem, that it's not just gun violence, it is structural violence that is embedded in, that started the way we started the United States through a racial capitalist system, but that says that folks are constrained by where they live through redlining and racial segregation. That means that some communities are hyper-policed. That means that we have heightened interactions with law enforcement, that even if you aren't in that community, if you are Black, you are more likely to be arrested and then jailed and incarcerated for longer terms. So it's really an indictment of the structural system, the policies, the laws, the organizational culture that we are confronting right now and we have to address. And so I think that's what, when we're talking about structural violence, we see it in the loss of life, and we need to humanize that, but we also need to say that it's beyond this interpersonal human interaction, it's a structural system. So one thing I just wanted to say quickly, a book that I also want to lift up is Celeste Walken-Hayes' book, Remaking a Life, where she talks about Black women and their heightened rates of HIV, living with HIV and AIDS. And she says that it's an injury of inequality, that injuries of inequality are produced to comprise the ability to protect oneself from physical or psychological harm, but that's due to social and economic inequity. So Black women in particular incur mental, physical, and social injuries of inequality, stemming from race, gender, class, sexuality, and so on. So these are injuries of inequality that say it's a systemic problem, it's systemic violence, but we feel those injuries and we need to address it at that level.
That's so, I'm so glad you laid that out, because it really leads me to talking or reflecting a little bit about Dr. Ford's work and her recent article on where she draws on Ruth Wilson Gilmore's definition of racism as the state-sanctioned and or extra-legal production and exploitation of group differentiate vulnerability to premature death. You're gonna have to break that down for us, because there's so much wisdom in that. And so let me give you the floor and see if you can connect some of the dots that Dr. Pirtle has laid out for us.
Thank you. I mean, that definition that Ruth Wilson Gilmore offers is really, it's a lot to take in. For public health, we tend to like them short and simple with our definitions, but I can never relinquish that definition because it really gets at several things. Number one, it gets at the fact that these things are happening in racialized populations. It's getting at the systematic nature of it, the forms of social stratification, and it's getting at the fact that they occur, if we are talking about illness and disease, we would expect that to happen along the lines of risks for illness and disease, not along the lines of social constructs like race and ethnicity. And in this case, when we do see these patterns occurring in populations by those lines, it should say to us, this is racism, structural racism operating here. The fact that she ends the definition of racism by talking about, death is really, it means that we cannot think about racism without thinking about the implications that it has for the body, for the physical body. It's not separate from what we experience. It is part of what we live. Yeah.
That's very important. And as we are connecting these dots, I think I want our viewers to recognize that, we're here tonight to say the names of the women that we've lost to racial profiling and racialized violence and structural violence, but we're also here to lift up that these things aren't happening in a vacuum. That in fact, there are disparities in Black women's health that predated this pandemic, and also that sort of co-occur and operate in tandem to diminish health, longevity and well-being among Black women. And so I want to keep us there for a moment. And let's unpack the state of Black women's health in general. And Dr. Amutah-Onukagha, your scholar activism has been so profound in the area of maternal and child health, and particularly around maternal morbidity and mortality. Talk to us lay the landscape for us. Help us understand that specific finding, because that's also been on the minds of folks here lately as we all witnessed, celebrity after celebrity talking about their birth experiences. So help us understand that a bit more and put it into context.
Sure. So just to frame this a little bit, I'll just start by some of the more jarring statistics. And even as someone who does this work every day, every time I hear it, I'm still just, I can't believe it. That 63% of maternal deaths are preventable. That's more than half, right, are preventable. That Black women are 243% more likely to die than their white counterparts. That's the other thing. Black women are 3 to 4 times more likely to experience either a near miss, which is a woman that hemorrhaged or a woman that had hypertension or different complications, than their white counterparts. And the underpinning for all that data I just supplied is the same thing we're talking about around racial profiling. It's the dismissiveness of Black women, it's the disrespect, it's the structural violence that Black women experience when they come onto the labor and delivery floor, when they have to interface with the clinical encounter, from the nurse to the OB to anyone that they come in contact with. We saw this play out in Serena Williams' case, where she just finished giving birth and she had to advocate for herself because she had a blood clot that had been getting treated, but she couldn't take the medication during her pregnancy. And after she delivered, she's like, I don't really feel right. She had to advocate and push and push and push. And guess what? They found a hematoma on her abdomen that could have had her to hemorrhage, right? How much of a stain would that have been on the fabric of the United States and the world? This is one of the top 5 best tennis players in history. And she had the resources. I'm sure she delivered in a fantastic facility that we would consider a top A hospital. And guess what? In that experience, she was dismissed as a Black woman. Let's talk about Beyonce, who, when she was pregnant with her twins, was hospitalized and bedridden for the last month of her pregnancy because of preeclampsia, which is a very dangerous condition that affects women. The only cure for preeclampsia is delivery. Now, preeclampsia affects the kidneys, the organs. It's when you have protein in the urine and the blood pressure goes high, and it's very, very dangerous. It can lead to permanent and acute damage. And again, this is someone that, again, has tremendous resources. So when you talk about the Beyoncés and the Serenas of the world, what about other people that don't have those resources? What about other women that are experiencing, they're pregnant with their first child, they're scared to deliver, they're scared to go into birthing hospitals? We know that even for Black women with education, PhDs, that's not a buffer for us. Let's talk about my colleague and friend, Dr. Shalon Irvin, may she rest in peace. We did our postdoc together for 2 years through the Kellogg Foundation. And what happened to her after she delivered her child in Atlanta? She had complications. She was talking to the nurse that came to see her at home. She had been discharged. She was having complications from hypertension, and she still died. Now, did her PhD save her? Did her degrees and acumen save her? No. Right? And so we have so many stories of these are the ones that we know that have garnered national attention. We're not talking about the ones that happen in Louisville and Memphis and Baltimore, Newark and Chicago and Boston and all these other places that we don't even hear about. And so it's important to understand that the thing that ties what I'm proposing to the concept of racial profiling is the disrespect and the dismissiveness of Black women. When they were perfecting these gynecological and obstetric procedures, they did it on the backs of slaves. Let's lift up the names of Betsy, Lucy, Anarcha. Let's dismantle this history of racism. James Marion Sims is being called the father of gynecology. This man was perfecting. Any woman that's had a pap smear knows how uncomfortable and painful those speculums are. Who do you think they perfected the speculum on? It was Black women's bodies with no anesthesia. And even now, there's still, if you ask the average medical student, they will still tell you that Black women and Black people feel less pain. So we're less likely to be prescribed pain medication. We're more likely to have our symptoms as being considered embellished or dismissive, or we're doing too much, or we're being uppity, or we don't know what we're talking about, as if we're not in our own bodies. This is what I'm talking about. It's the same thing that plays out in the system with police and the way that Black women are handled. We have so many cases of this. What about the sister from Princeton University? She's on faculty there. They mishandled her just like she was a criminal. She's a professor at the highest echelon and an Ivy League institution. They threw her on the floor like, why? Because she was out of place. You can't possibly be a professor here. You can't possibly work in this institution of higher education, right? That dismissiveness, that disrespect, that being considered less than, that we see play out in the clinical encounter in the academy is the same thing we're seeing play out in the prison and in the policing. It's the same pipeline. It's the dismissiveness, the disrespect, the less than. That's what we're seeing.
And that's so important to lift up, because I think we don't think about it in that way as healthcare professionals. Sometimes we think other systems are benign, that they're immune even to racism. Like we see people as whole people. We don't see race, yet racism gets embodied in ways that actually detrimentally impact Black women. And I want Dr. Allen to talk to us a little bit about this, because she's done a lot of work around the embodiment of stress, of racialized stress, and connecting the dots here. Especially, you've done work around how stress impacts maternal outcomes among Black women. So connect those dots. Talk to us, Amani, about embodiment. Like what does it mean to embody racism? We always hear, it lives beneath the skin. What does that really mean?
So thank you for that question. And thank you, Didi, for laying out all those statistics. I think all of those statistics are, on the one hand, shocking, but then on the other hand, not shocking, right? And in addition to the maternal disparities that Didi was just talking about, we also know that even when not in a situation where we're in labor and delivery, that there are still very stark disparities between Black women and other groups, right? Black women have higher rates of hypertension and lots of other chronic diseases. Black women have higher rates of infant mortality, preterm delivery, low birth weight, experience greater premature mortality than other groups. And I think one factor that's important in thinking about these disparities is that we tend to go to what we call the usual suspects when we're trying to explain, well, why do Black women have these higher rates of poor health conditions? And so we like to talk about socioeconomic status. We like to talk about access to healthcare. But we know, as Didi pointed out, that often Black-white disparities among women are greater at higher levels of socioeconomic position compared to lower levels of socioeconomic position. Those who are on the panel, and probably many on this call, have heard the statistic that a Black woman is more likely to have to experience a low birth weight birth, or to have an infant mortality experience when they are a college graduate compared to white women who are high school dropouts. Why is that the case, right? And we see time and time again that as we climb the socioeconomic ladder, that there are what we consider to be diminishing health returns. We don't get as much from increasing income, increasing levels of educational attainment, the way that our white counterparts do. Those kinds of factors that should be protecting us are not protecting us because of the skin that we live in. When we think about access to care, we know that when we think about the different patterns of, for example, access to health insurance across racial and ethnic groups, we see, for example, that Latinos have show worse percentages in terms of having health coverage, but don't necessarily experience the same poor health profile as African Americans. And again, I'm not saying this to pit one group against the other. I'm saying this to say that the pattern of health disparities that we see, where Black women are heavily impacted, does not mirror the pattern of these usual suspects that we argue, right? Because what we would expect to see then is that Latino women have the same poor rates of health outcomes as Black women if it were up to health insurance. And so the reason why I wanted to lay that out is to say that when we think about socioeconomic position, when we think about health insurance or access to care, when we think about genes, we don't even need to have that conversation because we know that's dead, right? Is the question becomes, what else is going on? What else is happening? And so many of us have turned to asking the question, how is this thing we call race, right? How is that getting under the skin? And I'm saying this thing we call race, to quote Ta-Nehisi Coates' work, and Between the World and Me, when he said that, race is the child of racism, not the father. And naming groups has never been a matter of physiognomy or genealogy, but of hierarchy. So what we're talking about is the experience of social hierarchy in this country that has led to intentional shunting of resources towards some groups and away from other groups. And so that leads us to the question again of why. And when we ask that question, why, then that gets us to the question of racism and really thinking about how does this thing called race get into the body, get under the skin? And when thinking about that is the question of embodiment, right? And so we think about if socioeconomic resources aren't saving us, if health insurance isn't saving us, if all of these other factors aren't saving us, then what's going on? And when we think about embodiment, we turn to things like the experience of racial discrimination and racism as mainstays in the lives of Black Americans, period, but certainly Black women. And in my own work, I've talked to and surveyed hundreds of Black women over years, and they talk about how, many of them talk about how they have experienced racial discrimination chronically over their life course. And they also talk about commonly how their first experience with racial discrimination was often early in life, somewhere around the ages between 7 and 9. And they often talk about this and say, that was the first time I learned that there was a difference with the color, suggesting that there were subsequent experiences. And so this is really about the experience of chronic stress. And we know that stress gets into the body, that there's a connection between the mind and the body, and that when we perceive threats, especially threats that are beyond our control, that are in some ways unpredictable, that we have a difficult time coping with because it's happening so much that we're actually not able to build back up our reserve capacity for dealing with subsequent stressors. And so it limits our ability to effectively cope with ongoing stress in our lives. And it has a direct impact on our cardiovascular system, on the functioning of our immune system, et cetera. And so we know that there have been a number of studies that have linked racism stress as a stressor to actual physiological changes that disrupt our immune system, that disrupt our cardiovascular system, our respiratory system, and on our metabolic system, that leave us, again, more susceptible to a variety of health outcomes. Racism has been also associated with telomere length, this measure of biological aging. And so I'm 46, right? And the question is, how old am I in my body? Because I can tell you that I'm 46, and from the outside looking in, any of us, people might say, oh, you look like you're pretty healthy, X, Y, and Z, but women are dropping dead left and right. And so what we're seeing with the policing of Black women, what we're seeing with the disproportionate impact of COVID-19 on Blacks, but also Black women who make up the majority of the essential workforce, is an exacerbation of long-standing pre-existing conditions. And the pre-existing condition I'm talking about is not chronic disease, it's racism.
That's really important to lift up. And it makes me think a lot about, as we're talking about embodiment, right? And about the differences in the experiences of Black women. And again, I love the point that you made, Dr. Allen, about this isn't about trying to shift the attention or the focus away from, our brothers who have experienced this, but this is really about a conversation in the village about what's happening to Black women who are holding up the sky, essentially. And it's often struck me that, building on Philomena Essett's proclamation that, racism is gendered, right? It shows up and operates in different ways for Black men and Black women. And I'd love to start with Dr. Ford, and others can jump in here and talk about, unpack what do we mean when we say racism is gendered? For folks who may not have had the privilege of reading Dr. Essett's work.
That we cannot understand how racism is operating without understanding that it operates on people and through people. And every one of us is seen through a combination of lenses, including race and gender and sexuality and so forth. Many of the ways that we talk about policing and racism really privilege subtly the forms of police violence that are most recognizable as they affect men, right? But we don't think about the ways in which the sexual exploitation of women by police, for instance, is another form of police violence. And thinking about it, in my opinion, thinking about the gendered and sexualized nature of policing in addition to its racialization helps to expand the many ways that racism, expand our understanding of the many ways that racism affects, that racism is intertwined with policing, right? So it's not that it's a way of saying this is happening to women and this is happening to men, but it's a way of saying this is what's happening to the whole Black community, that these various gendered forms and sexualized forms are happening in ways that disproportionately affect us. And I think it's critical because it's easy to see the shooting and the killing, especially of brothers, as the main outcome. When we use an intersectional lens that focuses on the gendered, sexualized nature of policing in our communities, it helps to illustrate that the death might be the final outcome, but there are other more proximal outcomes that we need to think about. The stress of mothers, daughters, and wives who are connected to the men who are stopped and frisked or shot or killed. The roles of incarceration. And so looking beyond just the policing and the police themselves to the entire carceral system and thinking about the ways in which it looks slightly different along these lines of gender and sexuality. And there are many different examples, but I'll give one that might not be so intuitive based on some qualitative work I did with lesbian and bisexual women who were surviving intimate partner violence. And there was something in this, in the set of results that we saw that we just did not anticipate among these racially and ethnically diverse women, which is they refused to name the police as a resource on which they would draw in the case of experiencing some sort of violent crisis in their relationships. And the reason that these people we would think of as sexual minorities were not calling on the police was because of what they understood about them based on their relationship to the police relationship to Black and Latino communities. So you can kind of see how that intersection exists not only for us, but it actually informs how other people understand and relate to policing, and the carceral state.
Thank you for that. Dr. Allen, I saw that you unmuted yourself. Did you want to add something here?
I did. And before I get to that, I just wanted to mention, based on what, if we can let go of some of the formalities, Chandra, something that Chandra just said about the women that were in your study, talking about how they don't necessarily see police as a resource. And I remember sitting in my office. I was sitting in my office after a very long day of teaching. It was after 5 o'clock. I was exhausted, and Freddie Gray had just been murdered. And I had covered my office door with "I am Freddie Gray" posters. And a white colleague came by my office. I said it was after 5, right? It had been a long day. And so he comes by my office and he pointed to one of the posters on my door and said, "I want to talk to you about this." And so he invited himself into my office and sat across the desk from me. He was not invited in. He invited himself into his office, sat across the desk from me, and sat there and said, "But why did he run?" Okay, so this is Say Her Name. We're talking about women, but it gets to the point, Chandra, that you were just talking about, that in the Black community, period, men, women, or otherwise, we have developed a learned reaction, a learned response to run, because police do not necessarily represent the symbol of protection in our communities, right? Based on the over-policing of all of our communities. And in thinking about gendered racism, one of the things, and I get asked this question a lot, well, what's different, what's unique about Black women compared to Black men? And Black men have a whole host of issues that they have to deal with that Black women don't have to deal with. One of the issues, however, that comes up with Black women when we think about gendered racism, and just to fan out a little bit, I remember having this conversation with Dr. Essed once, and I'm such a fan. I was just loving the fact that I had her on the phone. And so we were talking about gendered racism and what we call in public health network stress. And this idea about how women in general tend to report more stress associated with not only the things that happen to them, but those that happen in their social network. Whereas men tend to be more egoistic, right? Not egotistical, but egoistic. And so when it comes to Black women in dealing with not only their own racism experiences, but the racism of others in their social network. You know, I've talked to lots of women that talked about their tremendous concern for their sons and for their spouses and partners. And all of that adds to the burden of stress that women bear, increasing their biological and all other kinds of susceptibility, mental health, physical health, etc. So this idea of network stress, or we can think of it as linked lives, our lives as Black women are not distinct from the lives of others in our community. And as Black women, one of the roles that we hold dear, that has always been the case from the time when history began, is Black women as the center of the Black community, as those that hold up the Black community. And Black men do that in their own ways. But Black women play a fundamental role as a central figure in as kind of the glue that keeps the Black family together in some ways, right? So Black women that highly endorse this kind of caretaker role, this caregiver role, this nurturant role. There's even a hypothesis in the literature called the nurturant role hypothesis. And it's all about this additional stress from the caregiving role that Black women endorse. And so I think it's just important to kind of lay that out. So when we see, you know, our Black men and women, boys and girls being shot and killed on the news, even if it's not happening to us, we experience that. And we take that on ourselves almost as a source of responsibility. And so I think it's important just to kind of name that, and just to kind of end and lifting up the name of our brother Eric Garner. You know, everyone kind of talks about how when he was dying, and how with George Floyd's recent death, they both said, "I can't breathe." And when we talk about Eric Garner, we all talk about how he said, "I can't breathe." But right before he said, "I can't breathe," he said, I was starting to get comfortable. I was going to say, he was like, well, he said, "I'm tired of y'all messing with me. I'm tired of y'all messing with me day in and day out." And Black women are constantly, at least the Black women that I've talked to, are constantly talking about how they're tired. They're tired of everything that they have to take on as Black women, that kind of being a superwoman or being a strong Black woman. But although they're tired of it, it's a very important part of their role identity. And so in some ways, it's also seen as protective. So there are kind of some conflicting things going on there in terms of it being harmful, but also maybe beneficial in some ways as well. So I'll just kind of put that out there.
I think those are very important points. And I saw Dr. Pirtle unmute her mic, so I want to let you get in here. And then I will have a follow-up question for all of our sister scholars here. Go ahead.
Yeah, I just wanted to follow up with what Amani was talking about. Patricia Hill Collins, who has done a lot in terms of intersectionality, talked about this idea of other mothering that captures, you know, the labor that especially Black women do in the household, raising kids, but also in the community. And so, you know, I started this conversation quoting from the Combahee River Collective. And they said in that, writing in the 1970s, that the psychological toll of being a Black woman and doing political work can never be underestimated. And so I think that's really important, especially as we're talking about Say Her Name, racial profiling, and police brutality, that because we are hypervigilant and in the streets and carrying that stress of seeing ourselves, our sisters, our brothers, everyone being vulnerable to that structural violence has really harmful effects. And so Eric Garner said, "I can't breathe." And afterwards, his daughter, Erica Gardner, did a lot of community activism. But 5 months after she had gave birth to her child, she passed away. Like, the toll was so heavy. And so I think it's important to lift up her name too. Just today in the Brookings Institute, my colleagues, Rayshawn Ray and Allie Sewell, wrote about that. And so, thinking about Say Her Name, think about all of these community members, especially Black women who feel that psychological toll. And Dr. Allen and I just were on our PhD students committee, Katie Daniels, and one of the chapters in her dissertation used difference in difference models to think about Black women's maternal health when they're in an area that has experienced a highly publicized police murder. And she found that Black women in the area close to Ferguson were more likely to have preterm birth outcomes in the 9 months following Mike Brown's murder than the 9 months before. And she compared that to a place that's further out with similar demographics. And so all of these things, the health, intersectionality tells us that all these things are intersecting, and that there is a clear burden of harm for Black women thinking about the roles that we have in our society, but sort of the lack of power we have within those roles.
So important. And I want to, this is a really good place for us to be at this point in the conversation, because I've been itching to ask this question, and I'm going to do it in a particular way. And then I'm going to ask Dr. Ndidi to weigh in first. So I'm going to read you something by the brilliant Kimberly Crenshaw, director of Columbia Law School Center for Intersectionality and Social Policy Studies. She said in a recent article, although Black women are routinely killed, raped, and beaten by the police, their experiences are rarely foregrounded in popular understandings of police brutality. Yet the inclusion of Black women's experiences in social movements, media narratives, and policy demands around policing and police brutality is critical to effectively combating racialized state violence for Black communities and other communities of color. And what I want you to think about here, contemplate, is how do you interpret that statement, first of all, and why is it so hard, given all of what has been laid out here before, which is why we wanted to lay the foundation here. But given what we know about the compromises to Black women's health overall, even when racism doesn't get them, heart disease might, right? Why is it so hard for us, ideologically, politically, legally, Paige, to hold space for Black women's experiences with police brutality? Dr. Ndidi.
Well, my gut reaction is that, as Dr. Allen mentioned, like, Black women are just supposed to be strong enough to manage everything. We're supposed to be able to take on all the burdens. And I think a lot of times we don't get the same traction as our Black male counterparts because the media is not interested in uplifting our stories. We are not blonde hair, blue-eyed white women. If we look like that and they were getting killed at the same race that we were getting killed, it would be a totally different story because the imagery is different. For white women with blue eyes and blonde hair, and this is being very generalizable, obviously, but the story of their fragility. There's an inherent fragility. There's an inherent will to want to protect them, right? But for Black women, we're supposed to be able to hold it down. You're supposed to be able to manage the family, have the career, be the amazing wife and the mother, and lead the church choir all at the same time, right? And so there's the reception of the news, it sits differently with people in power, it sits differently with the media because we're not our white counterparts who are the ones that are supposed to be protected. Look at what happened to Emmett Till for whistling at a white woman. This little boy, he was 9 years old, just whistled at a white woman, didn't touch her, didn't assault, just whistled. And that was seen as so threatening by the white men in that community that they burned, beat, drowned, everything to this little boy. That's the sheer urgency and the propensity to want to protect white women. So if white women were experiencing, like Dr. Ford started talking about, the serial killers that happened in LA, if that was happening to white women, they would have every agency out there, the FBI, CIA, COINTEL, everybody be looking to find out who's killing these white women in LA. But Black women don't garner the same type of response, right? And so I think the premise is different for Black women in that we are supposed to be able to manage everything. We're supposed to be strong enough. We're supposed to be competent enough. All these things that are afforded white women who are allowed to sit in their femininity a little bit more than we are. That's what my gut tells me. It's just we are received differently in the way that we are perceived by the media. And let me just sit for a second around the imagery of Black women in the media. So I started off talking about Betsy, Lucy, and Anarcha, right? We talked about just the disrespect of Black women's bodies in the medical system. But let's talk about the imagery of the welfare queens and the welfare recipients, right? Black women are not even the largest recipients of welfare in this country. Okay, if you want to know who's getting welfare, look at white women in West Virginia, Kentucky, Mississippi, Georgia, Alabama. That's who's getting welfare. It's not Black women. And so the imagery of us in the media, right? Like all of us probably saw the billboards that say the most dangerous place for a Black baby is in its mother's womb. What is that? You know what I mean? The welfare queen, the crackhead, the crack woman, the crack mama, the crack babies. That's the imagery of Black women in the media. So why would you want to protect someone that has that type of imagery? Why would you feel the need to protect and to rally behind a woman that you see as less than, a woman that you have disregarded? Oh, Black women are on welfare, they're on crack, look at the crack babies. That's not the imagery that's actually happening. So we had the crack epidemic of the 80s. Now we have opioid in the 2000s, right? We have opioid abuse. We have neonatal abstinence syndrome, right? We have much more flowery terms because white women are now the ones that are doing the majority of this. And the pejorative nature of it that we saw in the 80s around crack, the punitive nature of addressing drug addiction under the Reagan administration, okay? This is the war on drugs, started in the early 1980s. Just say no to drugs. We had Nancy Reagan out here talking about just say no to drugs, okay? The way that Black women were regarded in that era versus the way white women are being coddled and supported, right, with the opioid epidemic. Totally different. And that plays out as well in police violence and police brutality. White women are supposed to be protected and covered. Black women are disregarded as less than. We see it in all these different areas.
That is such a brilliant breakdown, and I can't wait for Paige to get in here and to talk a little bit about, the sort of the systematic overlooking of Black women in the legal system around these issues. Paige, why don't you jump in?
Yeah, so something I want to lift up here, right, is that a lot of the police violence we see inflicted on Black women is sexual violence. And I really want to lift that up. The second most reported misconduct by police from community members is sexual violence, and that is right beneath uses of force. That is sexual violence, and that is only people who report. And something I want to note here that, Amani had been speaking about earlier when it came to Freddie Gray and about why he ran is, Black women there's been nothing in the history of policing that would lead Black women to believe that they could trust police and report something to police. And they can, because the police continually harm them. So there's obviously this fear of retaliation. But, between 2005 and 2014, there were over 1,600 criminal arrests of police officers for some type of sexual violence. And sexual violence accounted for almost 16% of the total number of criminal arrests made for police officers across the board. And most of this sexual violence is inflicted on Black women, and specifically Black trans women who are targeted even more because of the criminalization of sex work and the criminalization of just walking while trans. And so I really wanted to kind of lift that up here and say that, something that we just don't see in the media a lot is talking about sexual violence and all the harm that inflicts on women and non-binary people and men, but especially Black women who bear the brunt of this sexual violence. Another thing I just wanted to talk about is I just wanted to pull out this quote from Patrisse Cullors, who is just absolutely amazing. And she said, It's easier to be seduced by masculinity and the idea that we're going to be saved by a Black Christian male, and that's a problem. We don't fully understand how racism and sexism and patriarchy and homophobia impact our community. And I think that is just really important for us to center here. I also just wanted to center, so many women who've been murdered by the police, Black women who've been murdered by the police. And I really do think it speaks to the deep-seated misogyny in this country that all of these wonderful women on this panel have spoken to, especially when it comes to Black women. We had Ayanna Stanley Jones in 2010, who was 7 years old and murdered by police while she was asleep on the couch. This exact result of a no-knock warrant, the exact same thing that happened to Breonna Taylor. In 2010, 10 years after that, we're still allowing no-knock warrants, and they are still killing Black women. Similarly, Katherine Johnston, a 92-year-old woman, was murdered after a drug raid and a no-knock warrant raid. 92 years old, and a 7-year-old girl and a 92-year-old woman murdered by the police. And why do these stories not gain the attention? Why do they not get the attention from everyone across this country? Why are we not saying their names? And the final point I just want to make about how incredibly messed up our legal system is that, between 2013 to 2019, 99% of police killings did not result in officers being charged. 99% of police killings. That is a shocking number. Our legal system is set up to protect officers and to place them above the law. While we give them the power to enforce the law, they are placed above the law and very rarely held accountable for their actions.
I think that's important to lift up, Paige. I'm so glad you said that, because I think folks who perceive themselves sort of on the outside of this issue, like that it's not happening to them, might think that, that this is unfair that we're going after these law enforcement officers for these killings, and that they're here to protect and serve, and that this is so rare that it, and so you made it plain for us, right? That this is not a rare occurrence. We wished this was a rare occurrence. What's more rare is that people are not being charged, right, and prosecuted. And there's been a substantial conversation in the country about defunding the police. So I just want to, I need your input here, because I'm struggling with understanding how we can reform something that was actually inherently not, just broken. So help bring me along, and perhaps some of our viewers, about how this is or isn't the systems change approach we should be taking in this moment.
Yeah, I think the conversation around defunding and divestment, for me, for somebody who's been in this policing space for years, it's invigorating, right? I am glad that people are in the streets demanding this, and that it's not just Black people who are demanding it now that we have white allies who are putting pressure on their local officials. But really what we need to do is defunding, divestment is a strategy on the way to reducing police power, their roles, and their responsibilities, and their scale, right? It is a tactic, it is a strategy for us to use to get to a different world. And that's what's important to highlight here. We need a strategic reallocation of resources, funding, and responsibility away from police and towards community-based and community-led services and life-affirming programs that allow for communities to thrive. And I want to be very clear that when I'm saying defunding and reinvesting that money, that I'm speaking about reinvesting that money in Black communities, Indigenous communities, and Brown communities. I'm talking about reinvesting that money in the communities that have historically been targeted by the police and continue to be targeted by the police. That is where the money needs to go. And I think it's so important that we're having this discussion, because I'm seeing so many people talk about, well, safety and what are we going to do about crime? But it's really important for us to reckon with the fact that crime isn't random. Most of the time it happens when people are unable to meet their basic needs, and they have to rely on behaviors and actions that have been criminalized by our government. And furthermore, something that I've just been really harping on the past few weeks is that there are 10.3 million arrests made per year in this country, only 5% of those arrests are for the most serious offenses, what I think people are most concerned about, things like murder, rape, and aggravated assault. 95% of those 10.3 million arrests are for low-level petty offenses like marijuana possession, loitering, driving without a license, offenses that have gotten people killed, Black people killed by the police.
I mean, I'm just like, I don't know about the other panelists. I'm just rocked to the core hearing all this information. And I know it, and I've seen it sporadically in different places, but to hear it put together in this way should shock everyone's system and should be a call to action. And so I want to talk about the call to action, because we often think about sort of focusing in on, you know, the police system, which in law enforcement, which is an important call to action, but there are other systems, as we've talked about, healthcare systems, you know, the justice system for folks who are incarcerated. Like, there are many systems that are broken and that need repair, and that are part of the issue that broader issues we're talking here about, racism and structural violence. So I want us to, like, this group of brilliant scholars, thought leaders, to talk about what a call to action plan would look like. What are the changes we need so that we don't have to be the only ones that say her name, that everyone's saying her name, and really keeping Black women in the foreground as we try to move policies along to address the most recent of many crises around these issues. So I'm going to start with Dr. Pirtle.
Yes, I'm thankful to be a part of this conversation, because I think naming the problem and changing the narrative can go a really long way towards our walk towards abolition and freedom. So I know that we talked about say her name. I put in the link for Zoom that might be translated elsewhere. But I did want to lift up the African American Policy Forum and the Center for Intersectionality and Social Policy Studies that did the Say Her Name, Resisting Police Brutality Against Black Women campaign and report. And so I think, you know, part of that report is saying that we need an intersectional analysis to move forward. And I talked about parallel plagues. You know, we were talking a little bit about COVID-19. There was a push over 80 senators that we need to get more data to even understand the racial disparities in that data. But there wasn't that same level of conversation to look at an intersectional analysis. And so I was trying very hard to find race and gender breakdowns, and it's almost non-existent. The Georgia Health Department recently did a race times gender, and what you see there is that Black women outpace their counterparts for positive cases, their white women counterparts and their Black men counterparts. And so we need to have data, we need to change the narrative that an intersectional critical lens is necessary to understand, to pinpoint those intersecting systems and to address the narrative. And so in the Say Her Name campaign, led by Kimberly Crenshaw, one of those solutions is, for instance, to use an intersectional gender and racial lens when developing policy platforms to ensure that comprehensive solutions to state violence are being built and the myriad of ways that impacts the lives of all Black people are addressed. The Combahee River Collective, you know, they're talking about freedom and said that we need to center Black women. But in that it's not that, it's a need to center Black women because, again, it pinpoints those intersecting systems, but they also talk about collective action and coalitions. And so as we've talked about in this conversation, what other groups need to join in the fight? When we look at police brutality, COVID-19, also missing women, the indigenous population in the United States have extremely heightened rates of all of those things, all of those harms. And so we need to think about who are in those vulnerable positions, why is that the case, and how can we work together to move it forward towards freedom? You know, I think freedom is a really good endpoint. It's not what sort of intervention can we make, it's what sort of new vision, new reality, new world what might we make?
Absolutely. Chandra, help us reimagine this new world. What can we do to center Black women's experiences and put an end to racialized violence and structural violence in their lives?
You know, former APHA President Kamara Jones talks about how equity has to be understood in part by valuing every life equally. And I think about, Whitney, you talked about the link to allies outside of the Black community. Thinking about the Black women who were murdered over nearly 3 decades in Los Angeles, part of what happened is that people within the Black community and outside of the Black community did not value the lives of these Black women. And I think it comes from not valuing Black women's lives in general. And then on top of that, thinking that those who are within the deepest margins among Black women are devalued even more. So I believe that we really need to center those women who are not the respectable ones among us, and to embrace them as our sisters. I feel like that's something that we can do on an individual level, and also structurally and institutionally through the efforts that we make, whom we choose for our collaborations and those kinds of things. So I envision us and others looking for ways to see women whom we don't normally see. And I think of them as, again, women who love, labor, and live in the margins of society. And sometimes they love, labor, and live right in the mainstream of society, but behind closed doors, or maybe in the alleys, right? But how can we make visible and connect with those women who are more likely to remain even more marginalized and more invisible than many Black women are?
I appreciate that. Amani, many calls for, public statements have been put out, and there have been many, many statements that have been put out. How do we move beyond those to some real action and policy change?
Yeah, no, that's a good question. And I'm not going to pretend that I have the answer to it, actually, but I will say to just to start the conversation, also reflecting on a common comment that we hear Dr. Kamara Jones talk about, or it's a question, and that is, how is racism operating here, right? Because it is. It is. So let's name that. We are lifting up her name, but let's name that. It is racism. And I'm saying that from the perspective of how our country even came into existence. So we should be asking of every policy, of every program, of every organization, how is racism operating here? Because if it's not intentionally anti-racist, then it's racist. And to that end, I want to lift up the name of Kimberly Jones, who has been dropping major knowledge on social media. How can you win? I loved what she was saying, and I suggest that everyone, if you haven't seen it, that you go look at Kimberly Jones' social media diatribe, but the one that says new, where she has the pictures behind her and talks about how this country was really built off of greed and a system of capitalism and really the oppression by one group of people of another group of people. So when we think about our systems, I think we have to continue to ask the question, how is racism operating here? And when we think that it's not, it's even more important to ask that question again and again, because it is. And I also want to just raise up the work of one of my colleagues at UC Berkeley in the School of Social Welfare, Tina Sachs, who recently authored a book called Invisible Visits. And when we talk about Black women, a lot of what I've heard everyone on this panel talking about is really the invisibility of Black women, right? The invisibility of Black women. And so we, in public health, we talk a lot about health in all policies. So whether it's education policy or transportation policy, whatever it is, how might it or might it not impact health? What are the potential intended as well as unintended consequences for health? And so from that perspective, I think the health of Black women is not something that's always intentionally thought about because of the invisibility, which requires a lot of what Dr. Sachs calls invisible labor. or performative labor on our part in order to make ourselves known, in order to be seen. And so I think just like we ask health in all policies, you know, how do we ask that question not only of racism, but how do we start to think about the impacts of all policies, of all programs, of all organizations on the health and well-being of Black women? And in my mind, whether it's, you know, we could be talking about police violence, we can be talking about COVID-19, we can be talking about racial residential segregation or a number of other things. All of these factors are symptoms of a much larger root cause, and that root cause is racism. These are manifestations of racism, and so I do believe that we need to be asking that question about how is racism operating here, and really questioning all of our policies and being intentional with our policymakers, our legislators, to really put Black women in the narrative so that we're not an afterthought, and we're not finding ourselves asking the question, oh, I didn't know it was going to have that impact on this group. Well, think about it ahead of time. We should always be thinking about the most marginalized groups ahead of time so that we can try to avoid these, what I would like to say are unintended consequences, but I'm not going to say that they're all unintended.
Right. I mean, I think you raise good points because we tend to approach this as a zero-sum proposition also. You know, when we're talking about centering any community that is more vulnerable, it's always a loss-gain frame. And I've always said, as was pointed out earlier, that our fates are linked. You know, when Black women die, so do Black men. Even if that death is by 1,000 cuts, we're all touched by the loss of those lives. Dr. Ndidi, tell us what we need to be doing. How do we create systems change?
Systems change for me, and from where I sit in the academy, in the School of Medicine, system change is going to have to come from the recruitment, the retention, the training of Black scholars. I was the first person in my PhD program to complete a PhD in 3 years. When I started off as an assistant professor, I was the only new assistant professor that was a person of color. Okay, out of 40 new hires, I'm one of 2 faculty of color in my current institution. We know that this translates to poorer outcomes for people of color. I sit in a medical school. Less than 10% of OBs are Black. So who is delivering, we have 11% of OBs that are Black. We have 6% of medical doctors that are Black. Okay, so we have this proportion where you have 1 in 10 providers, right? The likelihood that you're gonna get a provider of color is small, right? We know that less than 2% of NIH funding, there's so much data that's come out from NIH, less than 2% of NIH funding goes to investigators that look like us on this call. So how are we gonna begin to change that? You're trying to find a needle in a haystack, killing yourself, writing all these NIH grants, which, you know, I just put one in 2 weeks ago. Okay, NIH, I need to give me that money. Okay, so less than 2% of funding goes to investigators of color. So you're talking about systems change. We need to recruit, retain, pay us what we deserve when you recruit or see your institutions. Let us come in as cluster hires. You bringing in one person here, how are you going to impact the change? So this is a problem. This is a systematic problem in the training of scholars and practitioners of color. And we see this exacerbated in poor health outcomes for people of color. If we don't have Blacks at the table in medical schools, in PhD programs, and engineering programs, and the policy spaces at the tops of these networks of power, how are you going to impact the change? Where is the change going to come from? These systems are not designed for our benefit. They profit. They have been able to thrive and to grow and to increase their endowments and their funding based on the lack of people of color. So when I think about systems change, I want to walk into a classroom, or I want to walk into faculty orientation, or I want to mentor students of color and not be the only one. Okay, that's what I'm talking about, systems change.
Yes, ma'am. We need to put an amen on the end of that, like twice, because, you know, I've been saying for days, you know, put your money where your racial justice statements say you are, right? You know, like put your, if every person that put out a statement around the recent events, and we're grateful that people are tuned in, if they would redirect resources, reallocate, redistribute, because your budget reflects what you value. Let me say that again. Your budget reflects what you value. So if you don't put the money there, I have to assume that it's not valued by you. I don't know how else to interpret it. And so I want to give Paige, an opportunity here as we are talking about systems change to lift up any other levers for policy and systems change that we have at our disposal. I know that in these moments, especially because we are laboring, we're doing the labor. These sister scholars, we're doing the labor while we're also experiencing what's going on too. And I'm often, wondering about, how do we consolidate resources, right? And reduce the duplication of effort. Where should we be putting our efforts now? Should it be on defunding the police? Should it be on looking at police unions and policies and procedures? What should we be doing collectively to move those levers?
Yeah, so I think it's really great that we're talking about defunding divestment. I think it's imperative that we seize this moment and keep pushing forward. Politicians are feeling the pressure. And I really I've been talking a lot about this in some work conversations, but I think what is so almost promising about this moment is that so much of what we're demanding when we talk about divestment and reinvestment happens on the local level, right? Happens on the city level. And so we all have so much power as constituents of different cities and towns. And I know people don't often feel like they have a lot of power when it comes to politics, but we have a lot of power on the local level. Our city council members will listen to us. Our mayors will listen to us. We are their constituents, and they are quite frankly scared of being voted out of office. So we need to be making demands from them. We need to be holding them accountable. We need to get them on record. We need to get receipts. For example, I am in Philadelphia right now. We had 14 out of 17 city council members make a pledge the other day that they would not vote to increase the Philadelphia Police Department's budget. Get them on record. Hold them accountable for that. If they are not held accountable, vote them out. Vote them out of office. They do not deserve to be there. So I really just want people to take this moment to recognize the enormous amount of power we have. There are a lot of other big structural changes that sometimes we can't impact on the local level, but policing and divestment and reinvestment, we have so much power right now, and we just need to harness that.
Exactly, because if I could harness all the power that is in this Zoom room tonight, we might actually take over the world. So I just want to, just speak words of gratitude for you all coming to this conversation on short notice, by the way, because we all felt the pressure and the desire and the need to say the names of Black women out loud and to implore the whole world to take notice that while we are fighting for the lives of our brothers who are valuable and dear to us, that we also can make space, hold space for Breonna Taylor, for Sandra Bland, for all of our sisters that we've lost. And so I want to invite the audience to continue to read, learn, and grow. We've dropped a lot of resources tonight in the Facebook live chat space, in our Zoom space, and we recognize that these conversations always feel foreclosed, too foreclosed too quickly. So this is one of many conversations that I think we need to have as a nation, as a community of scholars, as Black academics, and I hope that we will continue to say her name and continue to lift up the critical importance now of fighting for racial justice, freedom, and equality, and that we recognize that until we are all free, none of us are free. So I want to lift up, while we're sort of ending tonight's conversation, the handles. I think it's on a slide deck, if my ops team can bring that up, because I love that we cited all these beautiful Black women tonight. That is how we should do it. Cite Black women, for real. And so I want to also implore our audience members to follow our panelists and our partners. And while we're talking about partners, I want to thank the UNC Center for Health Equity Research and Dr. Giselle Corby-Smith and her team, who is a longstanding partner of mine, for coming together with us to put this panel together. On the screen now, you have the handles, the Twitter handles of all of the panelists. And if you want to do something tonight to empower Black women, you would follow each one of these women, Black women and brown women, and support them in their work. And I want to thank you for coming and staying with us through tonight's conversation. Please be in touch, be safe, and more importantly, breathe, people, breathe. Take care, everyone. Have a good night.
Thank you.